Studio 501c3. I'm your host, Kim Jones, Executive Director of the Nonprofit Village. Studio 501c3 features nonprofit organizations designated as charities by the IRS because they provide a public benefit. In most cases, your donations to them are tax deductible. We're proud partners with Montgomery Community Media, collaborating to feature our county's many nonprofit programs and services. Today, we're featuring Proyecto Salud, a nonprofit community health center that provides comprehensive and coordinated compassionate care. With me today to talk about the programs is Dr. Cesar Palacios. Welcome to the show.
Thank you so much for inviting me, Kim. Thank you so much. It's a pleasure to be with you.
Great. So we don't have much time. I want to try to get as much in as possible. So this is a community health center that's really focused on comprehensive and patient-centered care. Tell us a little bit about what's intended with patient-centered care and how it's a more coordinated effort for those that you're serving.
Well, thank you so much, Kim, again for the invite. Proyecto Salud started serving the community since 1998. And basically was the identification of needs for health education, nutrition education, and there were no clinical providers identified in the area. Actually, the main site, currently we have two clinical sites, one in Wheaton and one in Olney. But the main site is in Wheaton. As you know, has been for decades the center for a lot of diversity in many ethnic groups. So there was a huge need identified in this area. And that's why Proyecto came about to provide medical services to the low-income, uninsured, underserved community in that area. And we talk about providing coordinated efforts in services and patient-centered, because we realize that our patient population, that, by the way, 99% of our patients are immigrants. Around 89% are from Latin American countries, and the other percentage is basically from Asian and African countries. So a huge proportion, basically, of our patients, they don't know how the healthcare system works in this country. And also the huge need about medical services is right there because many don't have health insurance. If we provide medical services, health education, care coordination for patients with chronic diseases, we believe that we can provide a good service to our patients.
Okay, so navigating this, and it is a complex system that we have. Even if you are born and raised right here, it can be just complex to try to navigate the healthcare system. There's so many different portals that you have to go through and trying to access services. And then, of course, being referred on for further services. But this program is definitely more primary care based, correct?
Yes.
Okay.
Mainly primary care. We know that 25% of our patients need at least one referral to a specialist a year. So there's a huge need to complement some medical services with outside providers.
Okay, so tell me a little bit about I guess you have to have partnerships in order to refer on for specialty services. Is that something that you'll have to do with some of the patients also?
Yes, absolutely. Just want to clarify that we provide medical services to uninsured adults with the great support of the county under the Montgomery County program. But we are also serving Medicaid and Medicare patients currently. And so that obviously opens up more diversification for the type of services that we provide and also the type of patient that seek our services. But going back to your question, the hospitals, all the hospitals in the county are nonprofit, and they are great partners to the health centers like Proyecto Salud. They provide services at low cost or no cost, but also for specialty services, to say a gastroenterologist or nephrologist. There's a pro bono network, which is Project Access, but also Catholic Social Network. They also provide specialty services. So there are relationships with private specialists in the area because of the providers that we have. They have friends in the area, and they provide highly discounted specialty services. So that's how we can provide that next level of attention because, as you said well at the beginning, we are a primary care center. So we don't provide a specialty care. At times we have specialists providing volunteer services, cardiologists, gastroenterologists, but mostly we provide primary care services. We need those networks. We need those relationships with the hospitals, with Project Access and Catholic Social Network.
Okay, and that's complex in itself as well. And that's a lot of effort that you must have to put all of that together and to maintain all of those networks and all of those avenues that you then forward people onto. So can the services, though, be accessed by anyone in the community? You don't have to be Medicare, Medicaid, you don't have to be low income. Can anyone access the services?
Anyone can access the services. What we have right now, because our main program is Montgomery Cares. If somebody doesn't have a medical home, clinical provider, they can call our clinic and they ask for an appointment. And we can see the patient under the arrangement that we have with the county, 2 visits to figure out that the patient is eligible for Montgomery Care. That means that doesn't have health insurance. It has an income below 250% of the poverty level, which is around $55,000 for a family of 4, no health insurance, and live in Montgomery County. But also to see if the patient could be eligible for Medicaid or Medicare. So we can see the patient right away.
Okay, so there's some wraparound work going on there also, where you're assisting them in some of those other areas that they may not know that they're eligible for.
Yes, absolutely. Something that changed with the pandemic, because many services changed with the pandemic.
Right.
And we started also providing medical consultations, like telemedicine, like phone consultations.
Oh, right. That makes a lot of sense. Yeah.
A good proportion, a proportion of our patients, around 10% now, if I recall well, the last time I saw the numbers, of new patients that we have are coming because they have concern about the pandemic, about COVID. And basically, we can provide medical consultations on the phone, and we can refer the patient for a test. So there are some things that we can provide even without the patient in front of us.
Dr. Palacios, I want to take a short break, and I want to come back and talk a little bit more about that in just a second. You're watching Studio 501c3 on Montgomery Community Media. Stay with us. We'll be right back.
I think someone at my friend's school has this thing called autism. My friend's brother's son has autism. My neighbor's son has autism. My son has autism.
Autism is getting closer to home. Today, 1 in 88 children is diagnosed with autism. That's a 1,000% increase in the last 40 years. Learn more at autismspeaks.org/signs.
Brush, brushy, brush, brushy, brush, brush your teeth. Every day and every night. Brush, brushy, brush, 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 brush. Now it's your parents' turn. Here's what you gotta do. Let them have your toothbrush so that they can brushy, brush your teeth. Look out, you're almost done. 5, 4, 3, 2, 1. Now spit. Help your teeth stay healthy. Brushy brush with a grown-up every day.
Welcome back to Studio 501c3. I'm Kim Jones, and we're talking about Proyecto Salud with Executive Director Dr. Cesar Palacios. So before the break, we were talking a little bit about all of these wraparound services, all of the services that you have to assist the patients coming in and accessing, some that they don't even know about. Can continue on with that line of thought.
Yes, absolutely. In general terms, all the patients that come to our Center for Medical Services, now modified because of the pandemic, via phone or in person, we analyze the cases. And obviously, the patients, apart from the specific ailment, or complaint that they have about the medical aspects, they have other needs. When we realize that they have issues with home, they have issues accessing food, especially with the pandemic. We know there are a lot of other needs that are now more critical that we should try to support our patients. So we have the possibilities to connect the patients to other organizations in the area that provide other social services that go beyond our core set of services that we provide.
That's good to know. Yeah.
Yes, something else that we provide in-house, and I want to emphasize that because it's very critical at this point, is behavioral health, mental health. There's a lot of stress out there, so depression, so a lot of other issues around, in the past thinking about being an immigrant and having all those challenges. But
there's
now,
all those challenges there, and there's going to be even more.
Yeah. Exactly. So we are able to identify patients if they have general anxiety disorder, PTSD, or depression. So we have a collaborative work with Georgetown University with our clinical providers. So if the patient needs to have medication to say so, beyond just psychotherapy, we can provide that and provide follow-up.
Right.
But this is just one of the aspects that we provide.
And getting people to understand that any kind of crisis that you're going through, and sometimes just everyday stress, can be mentally challenging. And it doesn't mean that there is any long history of mental illness, that there's any ongoing cases of mental illness, but there are challenges that everybody is facing in some way. And understanding the services that can be available, just to have someone to talk with, or if you need more intensive services, it's good to know that you have. So I do want to get to, because that led us to a little bit about how these healthcare needs are changing over time. But with the last minute or so that we have before we finish today, how are you funded? Very quickly. How are you funded?
Thank you so much. Again, we are highly supported by the county under the Montgomery Cares program, but also along the years we have received funding and support from local hospitals for specific programs along the years for cancer screenings, breast cancer screening, to say something, an example, and also for any other aspects of women's health. Different hospitals support us in some other ways. And also we have fees, patients' fees. And if a patient doesn't have the resources to pay a consultation, that to say could be $25, $30, a patient is not turned away. We serve the patient anyway. But we have fees from the patient. We have support from hospital. We get grants. As you know, they can change depending on the year.
Right.
But we also get the main support from the Montgomery Cares program and Medicaid, Medicare as well.
Okay, and we've got about 30 seconds left. As a charitable organization, I just want to put this out there that you can take donations. And you do have a portal on your website, so people can go in and make donations, and that can help support all of the work that you do in so many ways. This is all very important. It's important for our viewers to know this, to use the services themselves, and also to refer others if they know that someone needs to be referred.
Yes, absolutely. Thank you, Kim.
Yeah, good. All right. So that is about all we have today, but I do want to thank you for being here. Dr. Cesar Palacios is the Executive Director of Proyecto Salud. So thank you again for joining me. If you want to learn more about the services, you can go to their website at proyectosalud.org, which you should see on your screen. And we hope that you're going to join us again next time on Studio 501c3. This is your window on nonprofits in Montgomery County. I'm Kim Jones. I'll see you soon on Studio 501c3 on Montgomery Community Media. This episode of Studio 501c3 was sponsored by MBA Growth Partners.